Doctors of Reddit, what's the biggest case of faking it you've ever seen? Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual I'm crippled paraphernalia: crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic, with her I'm crippled get up on again. A few weeks later I got the subpoena for the deposition, and it all became clear. What did you do at that point? We need part 2 of this story. I could not have sworn, under oath, that I had absolutely positively identified the woman power walking. I know it was her. I later confirmed she lived in that area. She and her attorney could have argued that it was her sister or daughter or cousin or whatever. So I just honestly answered all the questions during the deposition. Many I could not answer because I did not see her immediately after the accident. I could, however, honestly say that I thought she had a good prognosis and was likely to recover fully. By the way, it is not unusual for patients seeking compensation through some legal process to exaggerate the degree of their injuries. Everybody involved in the process understands this. It is however incumbent upon the patient to maintain their act in a believable fashion. Not a doctor but nurse. I once read a specialist's consultation report and at the end of the report the actual diagnosis given was fictitious ailment. Oh dang. Is a fictitious ailment something that can be noted in their medical records? There's actually a psychiatric diagnosis of factitious disorder, factitious with an A, which is a faked illness for primary gain. That is, the patient likes being in the sick role. This is contrasted with malingering, which is for secondary gain, like missing schoolwork, insurance fraud, lawsuit settlements, etc. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy. Nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. There's an even easier way. Just take their hand, hold it over their face, and drop their hand. If they are truly unconscious, or drunk, or very out of it, etc., they'll smack themselves in the face. If they are conscious, they will always do something to lessen the hit, like make their hand land to the side, or they turn their hand and hit somewhere they think it won't hurt, etc. When I was a kid I learned I could fake sick and get out of school. So 1 to 2 days a week I would get a migraine and hold my head and complain and I would get to go home. Eventually my parents took me to a neurologist who said maybe you just don't let him eat chocolate and sugar. I admitted to faking and was grounded for a long time. I grew up the opposite way. I would get 3 to 4 migraines a week, but everyone thought I was faking it because most days I seemed fine, just because I was learning how to deal with them and try to act normal. It wasn't until 8 years after they started that I went to a neurologist who said I have chronic migraines, which I dealt with unmedicated for 16 years. Now I'm on medication. I feel like my childhood was wasted. I also get regular migraines, but the doctor said I was too young. I was like 7 or 8 the first time I got one, and it wasn't until I was a teenager that anyone believed me. Medication doesn't work, but at least I know they're real. Editing to add, I've been on multiple medications, diets, health plans over the last 15 years. Medical cannabis isn't legal in my state, and my youthful indulgences were less than positive. Turns out I'm someone who gets real sad when she's high. Everyone else would be so chill and I'd sob for hours. The closest thing to a pattern that can be discerned is changing weather or barometric air pressure related, though migraines also happen at other times. So the doctor suggested moving somewhere with a mild, stable climate, like San Diego or Honolulu, which is not really feasible for me right now. And I react badly to the triptan family of medicine, which is often prescribed for migraines. I've taken 2, and both times I have severe side effects of throat and muscle tightness that made it difficult to breathe. The second time, the ER doctor just said I shouldn't ever take triptans again. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever. Leave it on the windowsill in my bedroom just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. Oh god, the smell of rotten meat. I know that smell. It's horrid. You got the long end of the stick, you and your dad. Me? Crap, my grandmother had a broken freezer full of liquefied meat that had been there for years. When my uncle wanted to throw it away, he tried opening it and the foulest smell came out. He immediately gave up and decided he'd throw it out without opening it. I was sitting at my computer, later in the afternoon, and I start smelling something weird. It smells really bad. I decide to follow that smell to the kitchen. Jesus Christ. You couldn't even breathe through your mouth because you could taste it. It was so bad. My grandma opened the thing up and was throwing all of the meat away. It was all liquid at that point. Our home stank for a week. Neighbors even commented that they thought something had died. I had to take all that trash out. Worst day of my crap life. Took a lot of willpower not to gag. No doctor but a funny story from work a couple years ago. Guy calls in sick for around 8 days, says on the phone he is really sick. Comes back to work the next week, tanned as crap. This dude hands a medical slip to the manager written in Spanish. On the slip there is an official seal from some random Cuban clinic. Guy walks over to me with a grin on his face saying yeah I'm probably fired. He was fired. Supervisor at a place I used to work called out sick. Came in the next day with a tan line right across the middle of his forehead from golfing in the sun all day. No one said a damn word. I told them I had to leave town because I had family members coming in last minute. I got written up. I should have taken up golfing. Posted this buffer but. Male patient, 18 years old, rolled and unconscious. Mom says he's been like that for the past 4 hours. Go to check his lungs when I hear something interesting. I place the stethoscope near his mouth and hear him breathe in normally, but then breathe out by saying breathe. No joke, male patient, 21 years old, admitted with inability to speak for last 2 hours and respiratory distress. Lungs clear, but we hook him up to oxygen for a few minutes. After he's taken off, his father comes running and drags me over, saying his son's tongue refuses to go back in after receiving the oxygen. I look at the kid and he's seriously just lying there with his tongue poking out like a child. I tell them to push it back in. A few hours later the dad tells me the boy is convulsing. I go to see without making my presence known and he's lying there just fine. The moment I ask the mom how he's doing, he starts convulsing. Think of an odd version of the worm, but on his back. Female patient, 16 years old, admitted with complaints of recurrent seizures and frothing from the mouth. I look at her and she is literally blowing spit bubbles. I check her reflexes, everything is intact. The moment I turn away to check on another patient, she suddenly becomes rigid and the spitting intensifies. Male patient, 30 years old, unconscious and completely unresponsive for 6 hours. This guy was totally dedicated to his act. I initially approached it as a stroke, but when the blood pressure, ECG, reflexes, pupils, etc. all are normal, I start checking pain sensation. He slowly began to open his eyes and groan as I asked him to tell me his name, but the moment his Achilles tendon was pressed, he suddenly sat up, stated his name, and declared himself cured. Female patient, 17 years old, Complained of respiratory distress and convulsions. Everything's normal on admission, and she's conscious but refuses to eat. Parents are worried out of their minds, and every few minutes she has a fit where she would just basically shake from side to side. She let slip to a nurse that she didn't want to go to school that week, so she was faking an illness. Since she was refusing to eat, the attending wrote up an order for a nasogastric tube, which was inserted and then removed by her in a matter of minutes. Thanks for watching. Subscribe and like this video, so all your dreams can come true.